Texas Agriculture Law YouTube channel. I'm Tiffany Lashman. May is Mental Health Awareness Month, and that is a topic that is near and dear to my heart and something that I've worked on for a number of years. Today, we thought it might be useful to share a number of resources that we have available related to mental health and agriculture. First, I want to mention a project that we're super excited about. We at Texas A&M AgriLife Extension have partnered with the Texas A&M Telehealth Institute to offer a service we call Farm Hope. What this is, it involves free counseling services that are available through the Telehealth Institute with a counselor who understands agriculture and the challenges that we face. These services are available over the phone, computer, or an iPad, and we've actually got iPads available we can download with the software and ship to people if that's something that would be helpful. And you can access the services simply by calling the Farm Hope number and asking for Dr. Miquela Spooner. You don't need a doctor's referral. You don't need to deal with your insurance. There's no diagnosis required. There's no limit on the number of sessions that are available. So if you are a Texas agricultural producer, or if you're a family member of a Texas agricultural producer, you qualify for the Farm Hope counseling services. Please, if we can be helpful, reach out to Dr. Spooner at the number on the screen. Additionally, I have done a number of podcast episodes over the last 9 years related to mental health in honor of Mental Health Awareness Month and Suicide Prevention Awareness Month, which falls in September. I thought it might be fun to just run through these prior episodes, tell you a little bit about them, and we'll certainly link to all of these episodes in the notes below. So our first mental health related episode featured Lesley Kelly. Lesley is the founder of a nonprofit based in Canada called the Do More Ag Foundation. And their mission statement says that foundation has a goal of being a champion of the mental well-being of the Canadian agricultural producer. And they've done a great job of doing just that. If you look up the Do More Ag Foundation, you'll see a number of resources they have available. We had a wonderful conversation with Lesley about mental health and agriculture. She comes at this with a background in agriculture. And so just a really great conversation on episode 90. We followed up with that in episode 106 with Adrienne DeSutter. Adrienne has a really interesting background that was a perfect fit for this episode because she is both a farm wife in Illinois and she's a counselor. And so she really is kind of at the intersection of the issues of agriculture and mental health. And really, I thought did a great job on that episode of offering some encouragement and tips from someone who truly gets it, what agricultural producers are going through when it comes to mental health. Next up, we had episode number 114. I was thrilled to be joined by Ted Matthews. Ted is kind of the grandfather of agriculture mental health. He's a counselor and has been a farm and ranch counselor for years in Minnesota. He's a huge advocate of agricultural mental health care and a number of programs in other states around the country related to ag mental health are truly based on the work that Ted does in Minnesota. So this was a great episode with kind of, like I say, one of the kind of folks that leads the industry on this topic. It was a great conversation. Next up, we did episode number 130 with my friend Shannon Ferrell, who is also an agricultural lawyer, but has a real heart for the topic of mental health. And Shannon really walked us through kind of some signs, symptoms, and conditions to be aware of for yourself and for your loved ones and your neighbors, and really talked about the importance of rural America pulling together, looking out for each other, checking on each other, and left us with a message: the world is better with you in it. So it was a great conversation with Shannon. In episode number 138, we visited with Maddie Caldwell. Maddie is an Illinois farm kid who very openly shares about her mental health struggles and her suicide attempts. It is a very raw and very important conversation, and I am so grateful to Maddie for her willingness to share her story. Maddie says that one reason she does that is a quote that she heard and that she kind of lives by now. And that is, if she recovers loudly, that will prevent others from dying silently. So, very grateful to Maddie for telling her powerful story. Episode number 161 is with a dear friend of mine, Paul Moya. Paul is a Harvard-educated businessman who unfortunately was launched into the topic of suicide when he lost someone very dear to him to suicide a couple of years ago. And Paul really used his kind of academic training to dive into some of the science behind suicide, which he calls the greatest epidemic facing rural America. And I found this conversation really helpful to understand, like I said, some of the science, some of what goes on in people's brains that we really just aren't trained on and aren't familiar with. So I thought it was a great information that came from Paul in that episode. Next up, we did an episode with Dr. Josie Rudolphi from the University of Illinois. That was episode number 162, related to farm health and safety. Now, this wasn't a completely mental health related episode because we did talk about some just general safety tips on the farm, which I found hugely helpful. We made some changes at my own house after the conversation we had with Josie, but we also did talk a bit about farm and ranch mental health in that episode as well. Last year, we had a great conversation with Grant Heinrich and Miquela Smith. Grant is an agricultural producer from an ag family outside of Slayton, Texas, and Miquela is our disaster aid and recovery health specialist located in Lubbock. I was super fortunate to get to work with Grant and Miquela on a great video that we did sharing Grant's story about how mental health issues and suicide have impacted his own family. We talked a lot about the impact that that story has had and are forever grateful to Grant for being willing to share that story. So that was episode number 177. We will also link to that in the show notes, the video that Grant was a part of. Last fall, in episode number 185, we visited with Brian Reisinger. He recently wrote a book called Land Rich, Cash Poor, which really focuses kind of on the history of farming in America. But he also very openly shares the story of mental health struggles in his family. In particular, he has a poignant conversation about his father, who is struggling after selling out of the dairy business. And that conversation on the back porch led to Brian being a really outspoken advocate for mental health of agricultural producers. And then most recently, this year, a couple of weeks ago, we released our podcast episode for Mental Health Awareness Month. That's going to be number 198, and it's with Chelsey Byers. This is a little bit of a different episode. It's still related to mental health, but we specifically focus on dementia and agriculture. And Chelsey has done a lot of work with dementia patients. She worked at a dementia care facility. She now is a specialist who focuses her work on dementia at the University of Illinois. It was a great conversation. I know there are a lot of folks who are dealing with dementia. I know there are a lot of caregivers who are dealing with dementia on the farm or the ranch, and our hope is that this offers some encouragement, some resources, and a reminder that you're not alone in that situation. So with that, again, I hope that these resources can be an encouragement to you. I hope that as we move through Mental Health Awareness Month, you will take the time to think about your own mental health and what maybe you can do to help improve your mental health situation. Reach out if you need to get help. If you know others who are struggling, just know that there really are resources available. You are never alone, and there's always hope.